hear your voice. Now tell me your name.
Larry Hogan.
And what are you here for?
Stem cell implant.
For what condition?
For Parkinson.
Parkinson disease, yes. Let me see. Can you do this motion? We can see the slowness in the motion. Can you bend it like this? Can you do it like that in your leg? Okay. Now the other side. Like a lot faster. Can you do this motion over there? Oh, very good. All right. Can you lift your arms up? Both. All right. Very good. And I want you to make like a circle with your toes, like this, like your feet. With the right side, the left side, sorry. Make like a circle. Yeah. Now the other side. A lot more limited. All right. Okay. So it's mostly the right side, isn't it?
Mostly the right side.
What's the right side? The speech. How is the speech?
It's a little better since
Since we did the sinus improvement.
but it was.
It's gravelly.
And very low, and the words would be very slurred. He'd get extremely mad at me because I kept asking him to repeat.
Yeah. Can you stand up and walk for me, please? Okay. Come back. Okay. Yeah. Yeah. Very good. And get up and get up and sit down. Very good. Still very like functional. He can do your daily life by himself, isn't it? Can you take a shower and do your stuff?
I can shower, but I have trouble using my right hand to soak anything.
And to eat?
To eat, I get my food started in my mouth and then suck it in.
Okay, so it's the coordination is not the best.
Coordination is not
It's
there.
awful on the right leg,
And a little
hand.
bit on the left side.
So you have to eat with your left side, or?
I eat with my right hand because my left hand don't work any better with a fork than my right hand.
Oh, okay, okay.
I've always been right-handed, and my left hand has always been impaired according to my right hand.
Okay, very good. All right. Well, this is a small evaluation before we do the stem cell treatment for Parkinson's, and we'll check you before you go.
Okay.
In a few minutes. Okay, this is a month after we did the implants for the Parkinson disease, isn't it? How you been?
I have good days and bad days.
Okay, tell me about the bad days.
Bad days is I've got a headache,
Okay.
pressure behind my eyes.
Okay, but the sinus.
Sinus.
The sinus is the one that's been bugging you.
Yeah.
Okay, in terms of the Parkinson's, how you think you're doing?
I walk straight now, and sometimes I'm in a kind of a daze. I have a little trouble remembering certain names.
Uh-huh.
I kind of hesitant when I speak to somebody because I can't remember their name.
Okay.
But other than that, I'm gaining the use of my arms. My fingers are agile again.
Yeah. Let me show me the. All right.
I can't tap them yet, but I can move them individually.
Yeah. Can you stand up and walk for me, please? Very good. And come back again. Very good. Sit down, please. How is your stamina? How is your energy level?
It's not what it should be. I don't
Okay.
think.
How is
I
it
get tired easily.
compared to the one before a month? How is that?
Before we came down here,
Uh-huh.
I got tired every time I turned around.
Yeah.
Just getting out of bed wore me out.
Okay. And now what can you do now?
Well, I work in my woodworking shop again.
Okay.
I like to do handyman work. I can do a little bit of that. My hands get to trembling when I get tired.
Okay.
But other than that, I can't make watches.
Okay. Yeah. All right. And what exercise are you doing right now?
Lifting 10-pound weight.
Okay. And how many can you do now?
Well, I can do 15 like this up here, 10 like this, and 10 like this.
Okay.
My right arm gives out first before my left arm. I can do 20 with my left arm.
Okay.
But my right arm gives out first.
All right. And walking?
Walking, I can walk. Nah, probably. I haven't walked very far yet at one time, but I walk straight.
Yeah.
I don't shuffle.
And what medication are you taking right now for Parkinson's?
Nothing.
Okay. And before?
Matter of fact, you're the only one that's diagnosed Parkinson's.
Yeah.
The other two doctors shrug it off.
Yeah. Interesting, isn't it?
Yeah.
Okay. How's your how do you say it? Emotionally, how you've been doing?
Well,
Remember that you had a depression.
sometimes I get a little feeling sorry for myself, but then it's only because I can't do
Compared to the way you were like a month ago to now.
Oh,
what
well,
would you say?
compared to what I was a month ago, I'm doing good.
Very good.
Because a month ago I didn't want to be around anybody.
Yep.
I didn't even want to be around myself.
Exactly. And what are you doing now that you were not doing before?
Well, walking the dogs.
Walking the dogs.
Except when it's really cold. When it's really cold and nasty in the north wind, I get my sinuses act up.
Yeah.
Once I get them done, well, I can get out and do things again.
Okay. Very good. Very good. And are you sleeping? How are you sleeping?
24 hours a day.
If he gets a chance.
Okay. How is the urination? The urine.
Well, I don't drink enough water.
Okay. So you don't go that often. Your color of your skin. Did you notice a difference in the color in the skin?
No, I'm handsome anyhow. I'll tell you what I can do. I can hold my razor in my right hand now and drag it down my face.
Yeah.
Before I had to shave with my left hand.
Right. That's great. All right. Well, this
I'm
is
still having a little trouble with the fork.
Okay. But this is a 1 month after and without any medication whatsoever. So I think we're on the right track.
I think so. I'm pretty sure we are.
Yeah. Very good.
Like I say, it's going to take time. It's not going to be an overnight miracle.
Yeah. But any reversal of your condition without medication, I think, is a wonderful thing.
Yeah, me too. Because I take enough medicine as it is.
Yeah. Very good.
Yeah.
Okay. Well, thank you very much.
Oh, you're welcome very much. Thank you.
You're welcome.